Hi, I'm Karen with My Kids Gay and I'm okay. And I have got a great guest today. It's Rachel Trout with Matthew 25. Rachel, welcome.
Thank you so much for having me. I'm excited to be here today.
I'm so excited. So, Matthew 25, for those of you who do not know, it's a vital resource for our community in Southern Indiana. And is it Western Kentucky? Tell me all your locations.
Yes, so we have 4 locations. We initially got our start in Henderson, Kentucky, but we also have clinics in Owensboro, Kentucky, Bowling Green, Kentucky, and Evansville, Indiana. So we serve a total of 37 counties across Western Kentucky and Southwest Indiana. And it just so happens to be our birthday. We are celebrating 30 years in service this year. So we have been active in our community since 1996 and continuing to grow and expand and serve the population that needs us.
Happy birthday.
Thank
Happy
you.
birthday. So back in the day, I'm a little older than you are. And I remember when the AIDS epidemic hit, I remember it was ignored because it was a gay thing. It was not anything anybody could get unless you were gay. That was the huge
Mhm.
misconception. And
Absolutely.
until it came over into the general population, there was a lot of misinformation, there was a lot of bigotry and hatred. I mean, I was talking to my daughter last night about it and was telling her things that people were saying, it's
Mhm.
it's God's way of cleansing the gays off the earth. I mean, that's basically what people were standing up, saying out loud until the heterosexual population got hit, and all of a sudden, it was a problem, we're gonna fix it. And that
Yeah.
yeah, and it was people didn't wanna sit on in public restrooms, they didn't wanna hold someone's hand, they didn't want to the misinformation that was out there in the '80s into the '90s, and then, like, 2 or 3 guys I went to high school with passed away, and one of the guys, he was just such an absolute sweetheart, and then in the late '80s, early '90s, his mother's she made a quilt for him in
Mhm.
memory, and it got accepted to the Washington, DC, and I thought she was so brave to
I
be
love
so
her.
open at that point in time, and of course,
Yes.
I didn't even have kids at that time, so I
Mhm.
had no idea what was in store for me, and I felt like she gave me such a great foundation to truly accept my kid.
Yeah, absolutely. And, sadly, while we've come so far in the progress of people accepting and educating themselves and realizing that HIV truly does impact all of us, there's still so much stigma and misinformation associated with the disease. And, we try to push that it's just a chronic condition. Today, in today's age, medication has advanced so greatly that people are able to live and thrive. I mean, in fact, our average patient age is 59 years old. And the wow factor to that is that in the height of the epidemic, as you were just speaking on, if an individual was diagnosed with HIV or a full AIDS diagnosis, if they lived to be 30, that was an absolute miracle. But now people are living and thriving, and we're serving a senior living population. And, it's just a daily medication or a shot that you can take. And yeah, but we are still battling the stigma that's associated with it. And that's why, conversations such as this one is so important to our work, just to push what all we offer and the proper education and information surrounding HIV.
Right, and then also as a parent of an LGBTQ plus kid, I just say alphabet kid.
Yeah.
You know, you're always worried about them. You're always scared. Society can be kinda cruel at times. The child's not the problem, it's society as a whole, and
Yes, I
same
would agree.
thing with the AIDS. So what advice would you give a parent?
What advice would I give a parent? That's a really good question. I would say take a breath. They're still your kid the same today as they were yesterday, and you still have to love them. And, in the event that someone is diagnosed with HIV, support them even harder. Come to their appointments with them. Learn we offer support groups. We offer a number of support services to wrap around the patient at hand. And we want our patients to bring in their family, whatever that family looks like. Sadly, there are still individuals who, have been shunned by family, friends, things of that nature. So we are their support system. So having a support system such as yourself to your son is crucial, especially And it's in a scary time of learning about not only HIV and the virus surrounding that, but about preventative measures for those in the LGBTQ community. So, yes, just keep loving them as you did before you knew what their status was, and continue.
And help them with resources as they need them. And I think that that's one reason why I did the podcast so that I can bring people on and people can go, "Oh, I didn't know," because we live in a rural community, and the more rural the community, the
Mhm,
less resources we have. And
mhm,
that's one of
absolutely.
yeah, that is really one of the things. I attended Denver Pride last summer, and I was blown away at this resources that those communities have, and it made me realize how limited we are in a more rural community and how much more important support across the board is important across the nation, but in a rural community, it's vital, and
Oh,
it's
it's
hard to
crucial.
come across with support.
It really is. And, each of our clinic locations are strategically placed. And the next close, just for reference, the next closest facility that's similar to the care that we offer would be Indy, Louisville. There is a facility in Paducah that's close to us, St. Louis, but we serve a mostly rural population.
Yeah.
And that is why when our founding CEO, Cindy Burton, started this, it actually started in a church in Zion Church of Christ back in 1996. And they were an open and accepting church. And they had noticed that there were some congregation members who were living with HIV. And this is, as you mentioned, in the height of the epidemic. There's still this fear mongering and things around it. And they wanted to come together as a church congregation to figure out how they could offer support and help these individuals in a time of need where they had no one except their church family.
Yeah.
So we started as in a church as a support group and just, offering whatever they could to give them some sense of peace and comfort. And, Cindy was or is a nurse, and she just didn't think that that was good enough and wanted to take it to the next level. And our first clinic opened in a detached one car garage, and we have expanded since then. And what she did was created this patient centered wheel to where the patient at hand is always in the center. And every support service that they could possibly need is branched out around that wheel. So not only do we provide HIV care and medication, we offer primary health care if they need that. We offer mental health support, food pantry assistance. We have a dietitian on staff that can work with, a specific dietary plan. We offer case management services, which is helping them get connected to those resources that they need, whether it's within our organization or within the broader community. We offer transportation. In a rural community, that is a huge barrier to healthcare is if you can't get to your appointment, you're not going to get the help that you need. And oftentimes we see clients who are maybe not even open about their sexuality yet, much less open about their HIV status. So even for some who do have a strong support system, maybe they're not comfortable letting them know about their status. So that limits them the, options to get to and from our facilities. So we offer transportation for that. And we offer patient medication assistance. We now have our own full pharmacy. So essentially, we operate as a one stop shop. Clients can come in and get any type of care that they possibly need and leave with all of those resources and supplies that very same day. We want to wrap around the entire patient as a whole.
Yeah.
So,
And I want to kinda tell people, when you and I are talking about Evansville and Henderson and Owensboro and then, Paducah, and if you look at Evansville as, like, the central
mhm,
area we're talking about, you go 2.5 to 3 hours in any direction, you'll hit a major city, but you're going 2 to 3 hours in a direction.
yes.
And I really want people to understand that this is a very isolated part of the country, you know, away from the rest of like Indianapolis, Nashville,
Mhm.
Louisville, and St. Louis, just like you said in Paducah.
Yeah. And much broader cities. They're more progressive, I would say, as well, than some of our, more rural areas. Henderson, Kentucky is very rural. So Evansville is the big city closest to us over here. And it's just, a hop and a skip across the bridge. But yeah, just having the services that you need to get back and forth. If you're having to make that 3 or 4 hour trip to a medical appointment, that's an entire day for someone, not only having to rework their work schedule, if they're requiring some kind of service that, they have to have a driver, there's 2 people's, schedules that are getting a little bit hectic, and that makes a full day of that. So, we like to provide everything within our organization the best that we can, and then, for those services that we don't provide, because we don't wanna recreate the wheel for things that other individuals and organizations are doing great, our focus is HIV care. So we will work with our case managers to get them connected and provide referrals to additional services that they might need. But
Mhm.
essentially, we cover pretty much everything that they could possibly need. And the one caveat is those supportive services, you do have to be HIV positive to
Right.
receive those. But we also offer preventative services as well. So
Okay. And you do offer education.
we do. We have our prevention and education outreach teams are out and about across the community in all 37 counties that we serve, and they do pop up testing events. They come into facilities and provide education. And that could look very different based on what your need is. We can do youth education for, high school, college age. We do hospital education with social worker teams. So they're also meeting patients directly where they're at as we are. So letting them know how to refer to us, what do we offer so that they can provide those services. We go into certain industries for staff to educate their staff on how do you treat an individual that's living with HIV. What is going to be different about their care? Why should we collaborate with you? We answer any questions that we possibly can to stop some of that stigma and misinformation
Mhm.
that's still out there.
Let me ask you this question. It just kind of popped in my mind. I don't understand AIDS and I don't understand the LGBTQ plus community. And I assume that those two go hand in hand. We know that they don't, but
Yes.
stigma's there. And I find out that this guy at work has got it. So what would you advise me if I were to ask you, hey, this guy at work has it? I'm a little worried. What
Yeah.
would you be telling me?
There's no need to be worried. There's advancements in care. There's currently still not a cure for HIV, but what we strive to do is get our patients to an undetectable rate, meaning that they cannot transmit the virus from person to person. So it's not, you can't catch it from a toilet seat. You can't catch it from kissing, hugging, sharing a drink, through mosquitoes. There's so many,
Hands, shaking
yes,
hands. Yeah.
nothing of that sort. It's not as easy to, transmit as individuals like to think
Yeah.
from, the early days of this. So no, you are perfectly safe. More often than not, the person is probably if they're in care, they're probably virally suppressed. And like I said, they can't transmit that virus. And that is our ultimate goal. And within about 3 months of care and proper medication, you can get to that virally suppressed rate with us.
Oh,
So
really? I
that
didn't
is
that fast. That's awesome.
yeah, that is what we strive for. And now they have to follow the rules and take their medication as they should. And we do regular labs. We also have our own lab at each of our clinics where they can come in and they have their lab work drawn. Like I said, it's all a one-stop shop. So, and we're checking those levels regularly to make sure they're in that virally suppressed status. So,
That's
yes.
fantastic. That is fantastic to know. So, and then is Matthew 25 a nonprofit?
We are a nonprofit. We are a
Okay.
501(c)(3) nonprofit. We do receive government funds from both the state and federal level, and we also accept donations. We are eager to have volunteers come in and partner with us in different capacities. We have a full food pantry, so we are always seeking donations towards our food pantry. Any non-perishables, things of that nature. We have an ongoing list on our website. Plastic bags and medium-sized boxes, that's usually the big thing that people are like, "Really?" But yeah, so we deliver these boxes to our patients. They can also pick up, but again, we provide transportation. We're in a rural area, so we have been known we deliver quite a few boxes each month, and we go through them quite a bit. So,
Fantastic.
yes, there's lots of ways to plug in to help us
That'll
and
be
get
great,
that
especially
take
like
action.
the food pantry. I mean, that would be such an easy thing to pick up, like a case of vegetables in cans at
Yes.
Costco or Sam's and drop
Mhm.
it off, or tuna fish or
Yeah, peanut butter is a huge way.
yeah. Yeah,
anything like that. And we have our largest food pantry. It's called Zach's Kitchen, based on it's named after a an individual that volunteered with us for many years, and he tragically passed away in a car accident. So we named the food pantry after him and all of his service. But yeah, we have a whole mobile ordering system to where they can, go in just like they were, doing the Walmart app shopping, and pick and choose from what we have available that meets their dietary needs or their likes and select those. And then there are certain days of each week that they can come and pick up those food items. Or, like I said, we do deliver to some, or if they have an appointment, they can come in. So we do bi-weekly deliveries, and then we do monthly deliveries as well. And that's another way that individuals can plug in with us, is to help with, food deliveries and things of that nature, or helping put the boxes together. So,
fantastic.
yeah.
Of course, you're like you said, I'm looking for volunteers.
Yes.
So time is money. So if you can't donate off, if everything's tight for everybody,
Yes, it
you know.
definitely is,
Yeah.
especially, in the current climate that we're in right now. The cost of everything is outrageous.
Yes.
So, a case of peanut butter will go a long way with us.
Yep.
So,
And when my kids were younger, my budget was tight, so I didn't have wiggle room to donate $10 or $20 to
mhm,
a cause, but I could go donate an afternoon. And so I would donate my time, and that was probably a little bit more valuable than any dollar donation I could have made as well.
yeah, absolutely. Yes.
Yeah. So I think we all kind of overlook that, that
Mhm.
that hands-on volunteer all the time. People think that to give is always the money,
Right.
but that time that you're gonna come in or show up to an event, like when we were in Owensboro Pride
Yeah.
Sunday, I mean, I had 4 volunteers with me there.
Mhm.
So
Yeah, and we're especially the month of June, we are all over the place with events, and we have National HIV Testing Day coming up this month. So, yes, if anybody is eager to get involved, it's a good way to learn more about the work that we do as well. And it gives you an opportunity to ask questions as you're in the mix of what we're doing. And I personally, I mean, I oversee volunteers, so of course I'm partial to it, and appreciate and love our volunteers. But, someone giving their time is invaluable. And I cherish someone's time a lot more than their money, essentially, because you're never going to get that time back. So,
correct. And right now, the LGBTQ plus community is under such attacks with the ongoing misinformation. And so I think it is really important that all allies really stand up and start speaking up and getting
mhm.
more involved.
Absolutely,
Yeah.
yes. And, we focus heavily on our prevention methods as well. So, not only HIV care. So, there is a national plan to try to end the HIV epidemic by the year 2030. And a big component of that is through a medication called PrEP, and it's a daily preventative for HIV. So we actually have a PrEP event tomorrow that is kind of pushing that. So basically, it's a daily medication similar to how an individual would take a birth control pill. You're going to take this every day, ideally around the same time. And when taken effectively and regularly, it is 99% effective towards preventing HIV. There's only two qualifications for that. To get on PrEP with us, you have to be HIV negative. But lucky for anyone who comes to us, we offer free HIV testing all the time. So we can do that test for you. And you must have insurance. And the great thing about our organization is we have patient navigators who can help someone find insurance that fits into their budget if they don't already have it. And then, yeah, you can be prescribed PrEP, which, like I said, is a daily medication you take. It's typically used for, let's say, an individual has a partner who's HIV positive, they would be a good candidate for PrEP. Or someone who exhibits risky behaviors, that might be an individual with multiple partners, or someone who injects IV drugs, or someone who just wants that extra layer of protection to be safe because you don't want to have to worry about the what ifs. And it's a simple medication, like I said, and it's 99% effective. So, and we also provide hepatitis C testing, care, and treatment as well. So we don't just focus on HIV. That an HIV positive individual would be the one that gets our full supportive services, but we do serve a lot of those in the looking for those prevention methods as well.
Yeah. And so every time I've been at a pride event, like, I think I saw you guys in Spencer County, I saw you at work, saw you at River City, I saw you at Owensboro. Which ones do you have coming up for June? I mean, are you gonna get any rest this month?
No, June is our busiest month. It is one of my favorite months. I'm a Halloween girly, but I also love the month of June. I am a true ally through and through. So our team will definitely be at River City Pride this weekend. We are actually one of the grand marshals for the parade.
Oh,
So
congratulations.
thank you. We're very excited about that. And we will be at Henderson, Kentucky Pride,
Mhm.
which is on the 27th of this month. We June is also filled with our Juneteenth a month events as well, so we have a few of those. And our biggest time of year is June for it being National HIV Testing Day is on Saturday, June 27th. So we will be having 3 different testing events this month. On 2 on the 24th, we'll be in Henderson and Owensboro simultaneously. We'll have our mobile unit out for debut as well. And then on the 27th, we will be in Evansville testing. And there's fun little incentives that go along with these testing events, just encouraging everyone to do their part in taking charge of their sexual health, getting tested for HIV. It's literally a finger prick test. Results in 60 seconds. And, that's the first step to taking charge of your health is knowing your status.
Yep. And then the locations in Owensboro and Henderson and Evansville for the upcoming testing, is that on your website?
It is, and
Right.
we share them a lot on our socials. We for National Testing Day, we actually partner with an organization called Greater Than HIV and with Walgreens.
Mhm.
So all of these testing events will be at our local Walgreens. So Evansville will be on South Green River Road.
Yeah.
Yes, Henderson, we will be at 402 2nd Street, and then Owensboro, we will be on Frederica, and with that one, we will have our mobile unit. So last year, we were blessed with a grant from the CDC that allowed us to work with an organization to develop a mobile testing unit, and we launched it this time last year for National Testing Day. And the goal is to meet people directly where they're at. As you mentioned, we're in a very rural area and transportation is one of the largest barriers that we see. So people can't get to us, we can go directly to them. So it ideally looks just like a giant, mobile RV. It has 2 testing rooms on it. We have all the supplies that we need, privacy as well. It is ADA accessible and we can, come directly into neighborhoods or parking lots or wherever to find our target population to provide these crucial services directly to them on the go. So,
That is fantastic.
yes.
And that way, if somebody can't drive to the clinic, they can maybe, like where the clinics park, meet
Uh-huh.
them halfway.
Yeah,
Yeah.
they can meet us there. And there's always no judgment, compassionate care. We meet individuals directly where they're at, and that is our goal is we want to try to find anyone who could utilize our services and benefit from that. So we're still currently in phase 1 of our mobile unit process, which is just providing HIV testing, hepatitis C testing. But as we grow and get into our second phase, that will be including more clinic services where we will have an actual clinic team on this bus with us that will be able to perform rapid STI testing. They could prescribe PrEP and just get people directly linked to our services and get them into care. So
That's fantastic.
I know. I'm so excited about it. It's my job involves a lot of I tell everyone they pay me to talk and brag about all the great and wonderful things that everyone else does there.
Yeah.
But it really is the best part of my job is to get to talk about all of these great things and see all of this progress. 2 years ago it was us launching our own pharmacy, which was huge and crucial because, I don't think people realize how many are still very private about their HIV status. And, when you walk into your local pharmacy and you're picking up a prescription, they've got this big label blasted on the front of it. And, lots of people could potentially see what medication that you're on. And that would be an identifying factor that you are HIV positive. So we have our own pharmacy where we have the very smallest script that we can have it printed on to have their medication listed. We can patients can pick up at our pharmacy just like you would CVS or anywhere else, but we can also ship and deliver the medications to our patients
And
very
that
discreetly.
yeah, that's really important because especially if you find out or you suspect you are HIV positive, I can only imagine it being paralyzing fear at first of
Yes.
the absolute unknown,
Mhm.
and then you don't want anybody to know because of the stigma,
Exactly.
but the longer you delay, the harder and correct me if I'm wrong, but I would assume the harder to treat the condition.
Absolutely. Yes. If they let it go for very long, you're going to be incredibly sick. You have that window of, at first you may have no symptoms. Some individuals have no symptoms whatsoever. But others ideally start with feeling like you're down and out with the flu. And then, you kind of feel tough for a couple of weeks and then you get better. So you may not even go to the doctor because you're like, oh, I just had a case of the flu. It's going around. I'm victim to that myself. It's just a stomach bug. It's the flu. Everyone has it. I have kids, blah, blah, blah. But yeah, the longer that it progresses without being treated, it could, HIV could develop into the final stage of the virus, which is AIDS. And that is much harder to treat at that point. So the sooner that, you suspect that you could be HIV positive and get tested, the sooner we can get you linked directly to care and get you on medication to help make you feel better, but also to help you live and thrive. And that opens up that door to all those services that I mentioned. So,
And just like you said, our average age is 59 years old.
mhm,
That says a whole lot,
I
you
think it
know?
does too. It's one of my
Yeah,
favorite stats.
and it would have to I know it would feel good because somebody comes in scared, they think it's an automatic death sentence, and now you're showing them that it's not, and you're sitting there supporting them on an emotional, spiritual, and holistic level.
Yes, and
That
that is, part of what we do is we provide holistic care, and we're trained professionals in this industry, and our entire team, when they do the testing, they are educated in how to have those difficult conversations because we have so many individuals that come in for a various amount of reasons to get tested, and some will even say, I think I could possibly be positive. I need to get tested. Having that confirmation of seeing that test result, even if you had it in your mind that it was a possibility, is still just mind shattering. And everyone reacts differently. And it's somewhat of a stage of grief for some. And so our team is there to say, you know what? It's going to be okay. Take a breath. How you're feeling in this moment is normal, but we are here to support you. We are here to be your family. We are here to answer any questions along the way. And we are going to do our best to wrap around you and get you to this undetectable rate. It is not a death sentence. You are going to be fine. And we're opening up this door to a realm of services that are going to help make your life easier through this time. And so, yeah, it's really great. It's really great, and that's also why I encourage other medical facilities to partner and collaborate with us. And if you have someone who's high risk that may potentially be an HIV positive individual, please refer them to our care. We can do so much more in that HIV specific realm than your local hospital can. And we have more leeway to offer more services and programs. And we have mental health support. We have monthly support groups that, you're kind of here with other individuals who have either been in the situation you're in currently or, are going through the same situation you're going through. And sometimes just having that camaraderie of another individual who knows what you're feeling in this moment means so much and just really makes it that much easier.
yeah, when you have those so I've been in support groups for certain avenues of my life, periods of
Uh-huh.
time where I needed things. It was such a help to find out that I wasn't alone. Other people had that, whatever it was, or that experience, and to have the support. And there was always somebody says, "Oh, yeah, I went through that, and this is how I handled it." It's
Yeah,
one thing to look for it on the internet, but when you've got a real life person that you can talk to that's already been there, done that, and they're
absolutely.
still here, they're doing this, they're going out, yeah, it's
Yeah. It
Huge.
makes a difference. It really
Yeah.
does. And so, we offer those. We have a meal. We oftentimes have a speaker that comes in for group, something that, majority of the members could possibly relate to. You may be a good avenue to come to one of our support groups
I was
talking
just
about
saying
your
the
book.
same thing, like, if you need some parent support, let
Yeah,
me know.
I
I'll
think
come
that would
in.
be that would be great. I could connect you to our counselors. And then, it's just a time to kind of go around and share with one another, hey, what's going well for you in this past
Mhm.
month? What are you struggling with? Is there anything that we as a group today can help and offer support to you for? And, oftentimes that ranges into a various amount of conversations and a wide range of topics. But there's just something about being surrounded by those that just get it and understand where you're at, or just being that safe space.
I think also support group allows you not to have to edit yourself and
Yeah,
that you're able to have those open and honest and as an old boss you'd say, real and raw conversations.
absolutely. Yeah. I mean, and sometimes it may be you want to scream to the rooftops about something that's just driving you crazy. Or maybe you have something that you really are thrilled and excited about that might seem mild to the rest of the world, right? But to you and the people in this group, you know how huge that step was to be there and support you. So it's great. I myself go to a lot of our support groups when I get a chance, just it's my way to kind of be able to hear some of the trials and tribulations that our patients face to better educate our community. Obviously we don't talk about names or show faces or identities. So oftentimes my role is difficult to get the general public to understand the importance of our work and the people that we serve. So hearing those stories and getting to see their raw, real emotions gives me motivation on how I can, preach till I'm blue in the face to the general public on why they should care
And
and support our work.
and those support groups are also a huge lifeline.
It really
They
is.
they they really are. So, hats off to you for doing that.
Yeah, thank you.
What else you wanna share?
Gosh, I don't know, I could talk for days. We've got just so many things that we do, and just, I would say most importantly, I would be dumb not to bring this up in the month of June. Advocate for causes that you support. Know your status. The CDC recommends everyone between the ages of 13 and 64 to be tested at least once in their life for HIV. I I can't encourage people to do anything more important than get tested. It really is easy. And that's the first step towards knowing your status and taking charge of your health. And it is a crucial first step. So please, you can come into our clinic, any of our clinics during open operations, and walk in to get tested. We are out in the community. It's all posted on our website for open public events. If you're in the area and want to pop in where we're performing testing, for those, I mean, we've even gone to like the Gen Z level of they don't like to pick up the phone and call people. You can schedule an appointment on our website without having to talk to anyone to come in and get tested. Just get tested.
Yeah,
So
it doesn't get any easier than that, and I will put your website up on this so that
thank
people
you
can
so much.
see
I
it and
appreciate
stuff.
it.
So,
Yeah.
fantastic. Well, I can't think of anything else right now, and probably as soon as we get done, I'll think, "Oh, why didn't we talk about this?" But you know what? That's the wonderful thing about this podcast. We can come back and do it
Yeah,
again.
absolutely. Yeah, and I would love to have you come and talk to our support group as
I
well.
would
I
love
think
to.
that would be amazing.
I
But
would love to.
yeah, but I appreciate you giving me this platform to speak about our work and the services that we offer. And, I hope everyone has a happy Pride and enjoys the month of June and also, takes charge of their health. And if you're an individual living with HIV, please don't be fearful. It's not a death sentence. If you're a person who's never been tested for HIV, I would encourage you to get tested. It's easy, it's simple, it's always free with us.
So, if
And
you're gonna do a test, I got a question. What
okay.
is it a simple blood test or what?
Yeah, it's just like a finger prick test, like having your
Oh,
blood sugar checked. So you will come in, there's a little teeny tiny bit of paperwork, but
mhm.
it's just, questions that our tester is going to ask, and they're very confidential. And then, yeah, they perform a little finger prick test. And then it looks like a little kids chemistry set where they mix this stuff together really quick. And you have your result in under 60 seconds.
Oh,
So, yeah, there's no sending it off to a lab and waiting for a hospital to call you days later. They used to do. You're going to leave knowing your status. And in the event that a positive does pop up on the test, we will say don't stress because with everything there could be false positives.
wow.
But if it is a positive, it's still okay. So we do a second confirmatory test. That one does take 15 to 20 minutes to get the result. And then if that test is still positive on the confirmatory test, you're getting linked to care and our services that same day.
Thing just starts right then and there, and you're
Yeah.
not going home stressing about it.
Or not, they are going to make sure that you are okay, that you understand the journey that's ahead of you. Most importantly, they're gonna say, "Take a breath. It's not a death sentence. We are here to help you." And they're gonna get you directly linked to our clinic, that's closest to you and get you into care with medication and any of the services that we provide.
That's fantastic. That is
Mhm.
I mean, that alone is peace of mind,
Yes, it really
you
is.
know? I was go ahead.
Oh, yeah, I was gonna say, and if it's not positive, we do encourage everyone to get regular testing. Based on your lifestyle. Oftentimes, homosexual men get tested every 3 months regularly. For others, maybe it could be less frequent, but we always offer free and confidential testing at any point in time.
Fantastic.
Yes.
Okay.
Well,
This
thank you
has
so
been
much,
great.
Karen.
Yeah,
Mhm.
thank you. So, yeah, Matthew, 25. This is Rachel Trout.
Yes.
So, Henderson, Owensboro, Evansville,
Bowling Green and
and
Evansville.
Green,
Yep.
Evansville. So, yeah, so we got some locations but you guys are a phone call away or contacting on your website.
Absolutely. If you want to talk to us, call. If you don't want to talk to us but need an appointment, get on our website, matthew25clinic.org.
Perfect. Thank you so much, Rachel.
Thank you. It's been a pleasure, Karen.
Thanks.
Bye.